Hi, I'm Jeanette Wider, and I'm Managing Editor of Healthcare Innovation. I'm here with Steve today from ForgeRock. Why don't we begin with you introducing yourself, your title, your background, your role?
Yeah, thanks, Jeanette. Great to be here. Steve Gwizdala of ForgeRock. I'm the Vice President of Healthcare for North America. And healthcare for ForgeRock is defined as payers, providers, med-life devices, and pharmaceutical life sciences.
Okay, if it's all right with you, I'm going to hop right into the questions. So, I know that the pandemic has changed healthcare, obviously. What types of demands are organizations facing because of this?
Well, what used to be healthcare was delivered majority through in-person visits has now switched to more digital touch points than what they've had before. And even though both rely highly on integrated digital ecosystems, the consumers themselves want frictionless, they want secure, they want integrated, they want a personal experience, they want more retail-like that they've experienced previously. So really, the pandemic has forced healthcare, if you will, to get on board with security, trust, privacy, and then being able to surround that all by digital identity and provide to the end user, the patient, just a delightful experience, a retail-like experience.
Okay, so that's a great segue into my next question. So now that healthcare is more digital than ever, what kind of trends are you seeing in the market?
Well, we've seen both good and bad, ironically. The bad trend is that even posted in our 2021 breach report, in the third year in a row, healthcare was the largest target as far as number of breaches, 34% to be exact of the total of all breaches. And in addition, that it was also the most costly out of all breaches at $474 per record. And we really expect that to continue that trend. On the good news of it, I guess we get away from the bad and focus on the good, is that healthcare is moving in a rapid pace toward your previous question. How do we get towards digital? What do we do now that our environment has changed? And what we've seen, even according to our partners at PricewaterhouseCoopers in their 2022 cost trend publication that came out, is they stated 58% of providers and nurses say that they want more personal health tools, such as applications, mobile access, et cetera, to coordinate patient care. Accenture even came out in their report in June of 2021 that 81% of all those that are surveyed in healthcare, specifically in the executive suite, say that the pace of digital transformation for all their organizations is accelerating. And so we really see these kind of divergence, if you will, as far as how digital is affecting healthcare, is how do we embrace technologies? How do we embrace and empower that user experience that I mentioned previously? But ultimately, how do we get better in healthcare in security because of these breaches that actually I stated earlier?
Oh, those were some really interesting statistics, and some of them were obviously a little bit troubling. And that's a lot for healthcare IT leaders to manage. How much do IT architectures influence how much they're able to achieve?
Yeah, that's a great question, Jeanette, because you're spot on. Most healthcare organizations have grown with hybrid IT architectures. And that means they've had on-prem systems, they have cloud systems. Most of these systems don't even talk to each other, which results in poor experiences and manual fixes and processes on the backside, as well as on the user experience as well. And those on-prem and cloud systems really need to be united. And they need to be united specifically to provide a fluid experience, well, for what the users want, but then in turn also provide the security that the IT, the chief information security officer, et cetera, on what they're trying to do to make sure they have the secure component of it. So really by integrating these disparate systems with a single view of the user and the identity, the customer can then actually provide a more personal experience to the end user, whether it's a patient, whether it's a healthcare professional, et cetera. And that's going to reduce the amount of time it takes them to jump from one system to another. And really, that's our goal that we help out with respect to healthcare, is to integrate these disparate hybrid IT environments and then scale to manage your patients, your doctors, your employees, your Internet of Medical Things, your devices, third parties, APIs, all these things that go into place. And then looking at how that whole architecture can then solve what you were asking, which is how do they go after it? What do they do and how do they achieve it?
Right. A little bit before you mentioned the digital experience, how does modern identity enable healthcare organizations to deliver both what consumers want and what their workforce is looking for?
Yeah, the digital experience is ultimately the key. You're spot on. When you're talking about disparate patient data and coming up with a single view for that patient to come in to consume applications and services and what goes on, the key of that is being able to understand who that patient, whether it's a member, a consumer, a B2B, et cetera, on the digital experience that they'll have. What type of access journey do they need? Where are they going to go? An example of that would be, for example, you go to check in with a provider. And I always pick on orthopedics since it's one I'm very common, or I know very, very well, is I go into the actual provider themselves. I have a username and password. I have an electronic medical record that now ties into a username and password. I go to see my orthopedic surgeon who's not in the main facility. He or she is at a separate facility. They have their own portal. They actually tell me to go get an x-ray to see a little bit more. Well, now my radiologist has a separate x-ray portal. And then maybe they prescribe PT. So I sign up for another party, which is for PT that isn't even part of this. I now have another username and password. So now I've got 5 different username and passwords. And to the end user, to me as a consumer or patient, I'm trying to figure out, how do I navigate across these systems? Am I now using the same username and password? If so, that's what leads to that breach report that I talked about before, is that by not having a unique identity and a unique password, I'm making myself at risk to lose my medical record number. All of these pieces come into play as to what the consumer's workforce and things like, for example, I'll pick on the retail industry. If you lose your username and password, but you know your username or maybe your phone number or your email associated with the account, you can do things like self-service of your password reset. I mean, how many times have you gone into a retail, you've already changed your main password at your work office for 4 or 5 times over the last 6 months, you can't remember your password to get into the site, but it does remember your email and says, hey, Jeanette, why don't I send a password reset to your email address? Or how about I send something to your cell phone number, which I have on record? And it's now enabling you as the end consumer to be able to do things like self-service. Sounds so simple, but I'm sure you can attest to this. How many applications do you log into, even as a retailer? And you're like, I can't reset my password. Or the running joke is you go to reset your password. It comes back and says, reset your password. You reset it and says, you can't use that password. You've already used it previously. And you're like, wait a second, if I just used it, why didn't you let me in? So all things go to that digital experience. Like, how does identity help the healthcare organization to deliver, like you asked, for the end consumer, and then translate that also to the workforce? Why do the people that work for the provider or the payer or the MedLife devices or the pharmaceutical, why do they have to have all this cool stuff as they're a consumer? But when they get in the door and they start working for the company, that they have all archaic things that they have to use today. So you're spot on with your question of how do they deliver it both to not just the consumer, the patient, the member, but why aren't they also doing something modern and adaptable for the workforce as well?
Right. So with the ability to create these custom user journeys and self-service capabilities, does this mean a heavy lift on writing code? What's the investment from the developer side?
Yeah, that's a great question. In the past, I would have told you, yes, you have to have a whole bunch of people on staff that can write code, maintain it, future-proof it, do all those things. And that's actually where a lot of healthcare people are today. They don't want to get rid of certain people because they know if they do, the knowledge goes out the door. The way ForgeRock approaches it is really using a no-code, drag and drop interface in order to do user journeys, customized registration, access journeys, all these things by user type, by role. And they can do things like enabling self-service password resets, account preferences, privacy settings, data sharing. It goes all the way through. And it was actually just featured in Gartner's analyst report that named us in the leader for the Magic Quadrant for access management. And it's called our decision trees. And it allows you to actually drop a node in and think of it kind of like a workflow. If you pass this, do you go this way or this way? If you go this way, then here. And as a person that's actually doing this, I can just simply drag and drop these nodes in. So if you came to me as a business owner and said, hey, we want to get closer to our patients. We want to know their cell phone number, maybe an alternate email address so we can get a hold of them, maybe some preferences as they have. We can actually drop those nodes in and say, okay, every third time or every fourth time Jeanette logs in, ask her for a little bit more data about herself, that we can collect that and add that to her profile so we understand you as the consumer even better. Now, again, in the past, that would have been having to write code, go through it, and that's not the way we are. So the ability to create those custom journeys that you asked about doesn't require that developer. It just really requires you to sit down with the business owner and say, what is the journey we want these end users to go through?
Interesting. So what about integration with existing systems like Cerner or Epic? How easy or perhaps difficult is it?
Yeah, the industry has become really good at storing records electronically. So as you mentioned, EHRs, electronic health records, EMR, medical records. And they've really focused on how do we secure those records? What do we need to do, et cetera. But what they've done less effectively is how do we access them? And how do we allow things like a thing like user managed access? Like how do we allow somebody else to let someone else have access to their record? Now, I'll pick on Epic as one, my chart. It's a purpose-built solution. It's very good at viewing medical records, but it's truly not an identity access management tool. And so some of these things that come into play is the different portals that I mentioned before, being able to have the ability to transfer those records to other providers, not just Epic at themselves. How do I manage the profile and preferences as the end user? And what do I do there? And that part of it, what it does is it works for a limited set of use cases. And since it can't really transfer data between healthcare systems unless they're sharing the same back end, what you have is CMS interoperability, and that kind of defeats that purpose of being able to share that. And so what we do by using standards like OAuth, open APIs, we can connect not only to EHR and EMR systems, but we can also connect to things like if it's an internal workforce situation to HR. If it's an external one, like the example I gave previously, where you're logging into radiology and X-ray and the medical record and PT, who PT has nothing to do with your EHR and EMR. This is where you get that more robust, user-friendly experience in around identity versus just the electronic medical record.
Right. Okay, so I'm going to switch gears a little bit here. Earlier, you gave a really interesting statistic and an important one that healthcare is the #1 target for cyber criminals. What role does modern identity play to help mitigate risk?
Yeah, it's actually the core of it. And people don't think about it until after the fact. You have somebody writing an application, they're focused on the UI, the user experience, what they're going to do, how it looks. You'll hear people say above the fold, below the fold. That's more in the marketing term of the world. Like, what do they see? How do they have to scroll down? But what they forget about is things like zero trust or continuous adaptive risk and trust assessment, which is CARTA. And what this does is it allows you, from an identity perspective, to continuously collect and interpret multiple signals about the user. So, for example, I log in with an Android phone. What we're doing in the background is I know the Android, I know the operating system, I know where you're located from a geofencing perspective. If you're on your laptop, I can do IP collection. I'm looking at the device, your network, the reputation, all the behaviors, all these things that go with it, which ties back to your question of how do we make it more secure and how do we get away from those criminals that are trying to take our identity? And along with that, if we add things like fine-grained access and authorizations, for like a high state transaction. What I mean by that is, let's say maybe you allow someone to log in just with the username and password into the main front end. I'll pick on the payer world. So the people that are giving your health insurance. I want to go look at what's available to me on the open market. I'm not really going to challenge you because going to look at whether you have a PPO or an HMO or whatever it is, and ideas of what the packages are available for, I want that to be low friction in order to get there. But now you've signed up for an account. Now you're looking to buy, or maybe now you're a user. Well, now I really care about who you are, your medical record number, can you share data or not? I really want to make sure that that fine-grained access of, if you're looking at your prescriptions, or if you're looking at your bills that came through and what's being paid, if you're looking at your benefits, these are things that I want to make sure that I make you really identify who you are in order to do that high state transaction. So that then allows you to go in and allow different layers to find out if it's, simple. Maybe I don't challenge you as much. As we do more, I challenge further and do things. I start to look at device fingerprinting, et cetera. And one of those other components that comes into play from ForgeRock is autonomous identity. And that's our AI solution. And what it allows you to do is actually look across all of your identities across your entire enterprise. So whether it's come in on a patient, or someone's gone kind of rogue or IT, shadow IT, and they've created their own database in SQL, we can consume all of that, including Active Directory coming from your HR system, et cetera, and then allow you to then identify what we consider low risk access and high risk access. It can also look at what's been over provisioned and what's been in there from an administration burden. So for example, a major US healthcare provider, and ironically retailer, they used autonomous identity. And when we went in, we actually consumed their entitlements. There were 14.6 million assignments that we looked in a subset. And we found over 550,000 excess entitlements in just that data set in under 3 hours. What this meant was over 500,000 entitlements that they had access as to what they should or should not be accessing, which goes back to your question about how do you mitigate or lessen that security. Well, if I have 500,000 people having access to applications that they really shouldn't have, that's a huge burden. That's a huge risk. Are they looking at patient data? Are they looking at medical records? What's there? And so that's just one element of how do we go in and actually lock that down and constrain that so we don't have higher risk.
Interesting. So now that the healthcare world is relying heavily on the connected Internet of Medical Things, how does modern identity play into that?
IOMT, so Internet of Medical Things. Yeah, it's definitely an interesting burden for IT as well as identities. In the past, a lot of our technology competitors would add an attribute to a person for a device. So in layman's terms, that means, Jeanette, you have to have a device. I'm going to change your profile to add that device to you. Well, the problem is you kind of talked in the very beginning, your first question, which was, how has healthcare changed? Well, healthcare has changed because most of it is now remote. It's telemedicine. Things are being prescribed to you that either can be shipped to you or picked up. Those medical devices now really should not be an extension of you, Jeanette. They should be their own device, their own identity, so they can be secured in and of themselves. There actually was a very large medical device manufacturer last year and the year before that was targeted specifically through their devices, that they were being held hostage, that they would change the attributes of those devices, and those devices in and of themselves could actually cause a patient to die. So it was ruled as almost like a homicide type event versus a device event. So the way we actually treat those devices, we secure IOMT devices and things as their own entity. Then we map and manage those devices between a human and the IOMT. So the example I gave earlier with respect to your device, let's say I gave you a device to take home, a pulse ox, for example, and I want to measure it over the next 48 hours. Under our security and what we do, that pulse ox will have its own device in its own ID. We'll then map it to you. You take it home, it has its own security, it's talking back and forth with your identity. When you ship it back or bring it back, it'll actually be disassociated to your relationship and reassociated to whoever takes it next. Therefore, we're never changing or modifying your security and your identity. We're actually managing the IOMT as a separate entity all in and of itself. So it's a key element on how to make sure these connected internet medical things. And by the way, there's more and more that are happening. You've probably heard of smart operating rooms, where everything in there, every device can be associated with a nurse or a doctor, and each one has different parameters. We can accommodate that. So it has definitely changed how that works.
The next thing I want to talk about are regulations. There's obviously many important healthcare regulations such as HIPAA and the 21st Century Cures Act. How does identity help organizations comply with these?
Yeah, there's actually even more regulations than that. So they seem to be coming out on a monthly basis. So for example, not just HIPAA or 21st Century Cures Act, which I'll cover, but even CCPA, the California Consumer Privacy Act, or GDPR from a global perspective, is what we handle is the confidentiality. So if we pick on HIPAA specifically, is making sure information is not available or disclosed to an unauthorized individual, entity, or process. That's part of HIPAA from a confidentiality perspective. They also tie into integrity, that the accuracy and completeness of the information and related all to all the assets that we talked about is safeguarded. Availability, and making sure that the information is only accessible and usable upon demand and only by the authorized entities overall. So everything that we do is always focused on regulations and how to comply and how do we keep things safe. So privacy, consent, dashboards, making it easy for the users to manage their settings, but then in turn, making sure we have the whole provenance of trust that goes with it. So an example, if I wanted to share my data with you, you were part of my family or maybe a caregiver, and I'm going in for surgery and I want you to know my medical records, my prescriptions that I have, et cetera. I, as the end user, can actually go in and give you access to my medical records. As the provider or the payer, I have the full provenance of trust that goes all the way through. Steve gave Jeanette permissions to see this on this date, complied with our privacy and consent terms, did this, did this. After I finish it, and maybe we don't want to have you on my records anymore because you're like, hey, you're fine now. I revoke that as the end user. That's considered user managed access. And that's a standard UMA standard. And that is another way from as I was saying, as far as regulations, HIPAA and 21st Century Cures Act. And then you can couple things like FHIR, which is data portability, which is under 21st Century Cures Act. And this allows patients to easily collaborate and share consistent information across providers, payers, et cetera. So all of these different regulations, what we've found is that identity can be an enabler right in the middle of it as to how we actually help them comply with what they're doing today when it boils down to the single common denominator of the identity.
Okay, so I have another question that goes in like a little bit of a different direction, but what happens to legacy systems when, this modernization journey gets started?
The key word for us when we look at legacy systems, because everyone comes from something, there's very rarely that you go into any particular client and they say, I have nothing for identity. That would be very odd to run into, unless it was a startup, which we are seeing as well in the independent software space. We see a lot of new startups that are trying to figure it out. But in a legacy system situation, the one word would be coexist. The way our platform is set up is that we actually let you build upon your investments by adding our IAM experiences and security controls on top of your legacy systems. So what we can do is, you may have heard the phrase of eat the elephant, which is these giant, applications where they come in and say, okay, we've got to do everything. That's not the way we approach it. We approach it with an API first design in order to coexist with the legacy solutions so we can hit immediate value. So if you came to me and said, hey, Steve, our legacy system can't do passwordless. My answer is I can. Let me tie into it. Let me suck information out of it. We'll make it secure. We'll do passwordless and make it better. And then over time, what we can do is then change it and run from either on-prem on a legacy system. We can move it to like a private cloud, like for example, AWS or Azure or GCP. We can even ultimately move it to our software as a service and let you go that route as well. And that's kind of where we fit from a legacy perspective, is that flexibility to look at it and say, okay, how do you want to run? Do you want to run on your prem? Do you want to run in cloud? Do you want to run into our SaaS? Our answer is yes, we can do all three with our unique architecture and what we can do overall. And so when we look at legacy, we're really focused on how do we get rid of systems from a surgical perspective and take out those particular items that aren't working well. Or if it's a pure modernization perspective and they're saying, you know what, we want to go from our legacy that we have today, it's not working properly, to a more modern approach. We could put a front end on the legacy as we build the other piece behind it, as we start to configure it, and then move over as we go, therefore reducing your overall IT resource, time, and budget. But we have to be very specific how we approach the legacy, but it's definitely something we do on a day-to-day basis.
Okay, so I think we have time for about one more question. And I've seen ForgeRock in the news a lot recently. What makes ForgeRock unique in the marketplace?
So I would say there's a couple key elements that the unique cloud architecture that I just referenced on the previous question that you asked on that, Jeanette, is we say your cloud, our cloud, or any cloud, is that the ability to go on-prem, private cloud, or our SaaS is definitely unique to us. And one component of that I failed to mention is that if you're running Azure or AWS or Google, is that we actually bring cookbooks that have all the components for Kubernetes and Dockerization built into those cookbooks to make it super fast for our clients to deploy in those environments. So that's our unique cloud architecture. If you look at it from not just ForgeRock, but what's the market saying? So like you said, you've seen us in the news, hopefully not just because we went IPO, but that's one of the reasons, I'm sure. But Gartner, Forrester, and KuppingerCole, the top 3 analyst firms in the identity and access management space, we were the only provider named in the leaders quadrant for all 3 and scored the highest for our consumer identity and access management, which is B2B, B2C, so business to business, business to consumer, actually business to everyone. So if you pick a use case, for example, like pharmaceutical, where they're dealing with healthcare providers, they're dealing with the actual patient, they're dealing with primary care physicians, they're dealing with the actual drug manufacturer themselves, we consider that B2E. So that would be another piece. And then I would also talk about the fact that from an overall scale perspective, we have 3 billion identities under management. So if you took our 2 closest competitors, added them together, they wouldn't even come up with the number of identities we have under management today. And then lastly, since we're talking about healthcare, I've got to get a plug in for healthcare specifically, is that we invest specifically in the healthcare vertical, and we're driving key innovation in this space. And so one thing I mentioned about user managed access, that is one component, but we are a founder of the OpenID Foundation on the Health Relationship Trust Heart Working Group. Well, I mentioned user managed access. We were the founder and leadership of the UMA standard. We're also, our CTO, Chief Technical Officer, is on the technical expert for the US Office of National Coordinator, ONC, on health IT. And she comments on matters such as health IT priorities, API security, and privacy. So I had to at least get a plug in for the healthcare vertical since we're here today.
Yeah, well, it's nice and it's refreshing to hear that your company is specifically investing in that. But unfortunately, we're out of time, but I want to thank you so much for sitting down and talking with me today. This has been really interesting.
Jeanette, thank you too. I really appreciate the time.
Thanks.